I rise today to talk about health care for our rural veterans. This is a critical issue to many veterans who are left behind and to many who are not getting the care that they need. But first, Madam President, I want to say how important it is that we have reached an agreement to restore the cut to pensions for working-age military retirees. This cut and cost of living adjustments for military retirees should never have been included in the budget bill. But let's be clear, the bipartisan budget agreement was critical to New Mexico and our nation because it rolled back damaging sequestration cuts that hurt our military and military families. But working-age military retirees should not have to bear the burden. Many of these men and women have given decades of service to our nation. They were willing to give everything for us. They should get the benefits that they've earned. I've been working from the beginning to restore this cut to their COLA benefits. I've been very happy that we have a bipartisan agreement to move forward and ensure we keep our promise to them. Now, Madam President, I come to the floor today to also talk about rural veterans and a Rural Veterans Improvement Act. I was proud to introduce this bill with Senator Heller from Nevada earlier this week, because when it comes to veterans' health care, we know there are challenges. We know that we can do better, and we know we have to do better. Over 6 million veterans live in rural areas, including about 1/3 of those that fought in Afghanistan and Iraq. 3 million of those rural veterans receive health care through the VA. Our veterans have fought halfway around the world for our freedom. We should go the extra mile for them. Senator Heller and I we both come from rural western states. We know the difficulties veterans face when distances are too far and choices are too few. And so our legislation would do 4 things: improve access to mental health services, expand transportation grants, hire and retain more medical professionals in rural areas, and give Congress and the VA improved tools to improve the quality of rural facilities. First, let me start with mental health care. This is crucial. Veterans are struggling when the help they need is not available or is very far away. One of my constituents lives in a rural area in northern New Mexico. He fought in Vietnam and was diagnosed with post-traumatic stress disorder. He required therapy 2 full days a week for 2 years, vital care that probably saved his life. The VA was there for him, and he is grateful. But he had to drive to Albuquerque, over 3 hours away, to get that essential care. The veterans in my state are clear. They need better access to treatment and more mental health options. One size does not fit all. Conventional therapy does not work for everyone. Veterans groups like the Wounded Warrior Project have long supported alternative treatments and more holistic methods. Tribal governments are also working with the VA to use traditional Native American healing techniques, helping their veterans with PTSD and other diagnoses. These veterans are in pain. They are at increased risk of suicide. Help has to be there when they need it. Our bill would enable the VA to work with non-VA fee-for-service providers for veterans with service-connected mental health issues. When conventional treatment is not available or where alternative treatment is not an option. Second, even the best health care is useless if you can't get to it. I have talked with many veterans in my state about this, and it is a big problem across New Mexico. Veterans in Carlsbad face a 6-hour drive to the VA hospital in Albuquerque, 300 miles away, one way. One such veteran fought bravely in World War II. He's in his 80s now. He has to get up at 5 a.m., make the trip to Albuquerque to see medical specialists. Sometimes he doesn't get home until midnight. Thanks to the great volunteer drivers at Southeast New Mexico Veterans Transportation Network, he is able to get there. But it is an exhausting day. Another of my constituents recently retired to Chama, New Mexico, a rural community in the north. He and his wife built a home there, looking forward to retirement. The VA outreach clinic was nearby, but its contract was not renewed, and it closed. His only option now is the VA clinic in Espanola, 80 miles each way through the southern Rockies. And when winter storms come, as they do in northern New Mexico, he may not be able to get there at all. The VA offers transportation grants to help, but only for veterans in what they call highly rural areas, with fewer than 7 people per square mile. Not for those in rural areas, in small towns like Chama, and the small towns in Nevada, and so many other states. They need help too. The miles are just as long, and the journey is just as hard. Our bill will help by expanding VA transportation grants to include rural communities, and it will not require matching funds for grants up to $100,000, making it easier for these communities to apply for assistance. Third, rural VA clinics, like their private counterparts, have trouble getting staff and keeping staff. This is not news to veterans who see constant turnover of doctors and nurses and other healthcare professionals, or who have to travel long distances just to see anyone at all. Our bill will establish a VA training program, working with university medical centers to train healthcare professionals, serving rural veterans at outpatient clinics. Those who complete the program and a 3-year assignment will receive a hiring preference for jobs with the Veterans Health Administration. We also propose a pilot program for housing incentives for healthcare professionals to work in rural VA facilities. And we are proposing that the VA streamline the hiring of military medical professionals transitioning to the civilian world into the VA system. Rural VA health centers have a big job. They do their best. We have to do all we can to help them, to get staff and to keep staff with incentives, within training, with innovation. It isn't easy, but it's essential. Fourth, we call for a full review of VA community-based outpatient clinics in rural and highly rural areas, so we can prioritize expansions and improvements, making sure dollars are well spent and resources go as far as possible. We also call for a report to Congress on whether to add polytrauma centers in rural areas to help veterans from Iraq and Afghanistan recover from multiple major injuries, like serious burns and traumatic brain injuries. Every day, American service members wake up far from home, and every day they stand watch. They do their job they promised to do, and not only if it's easy or only if it's convenient. We owe them the same promise. Rural veterans should not be left behind. They should get the care they need and deserve. Again, I want to thank Senator Heller for working with me on this bill. He understands the problem. He's committed to finding solutions. Our bill is a step forward for the health and well-being of our veterans. This is about essential care, about access, about honoring our commitment to the men and women who have sacrificed so much for our community. I would urge my colleagues to support the bill.